Instant Neuro! Sleep disorders. Narcolepsy is characterized by sleep attacks. For diagnosis in DSM-5, at least one of the following is also required: cataplexy, an abrupt loss of muscle tone, rapid REM onset, hypercretin, orexin deficiency in CSF. Patients may also experience sleep paralysis, hypnagogic hallucinations, and excessive daytime sleeping. Insomnia is characterized by a chronic inability to fall asleep. Primary insomnia involves an abnormality in the sleep mechanism, with no signs of a psychological or medical problem that could explain the disorder. Secondary insomnia is associated with a psychological or medical problem, such as pain or alcohol or drug abuse, and is usually of short duration. Behavioral therapy is the first choice of treatment. Drug therapy includes a melatonin receptor agonist. Sleepwalking occurs during N3 delta sleep and is characterized by unusual autonomic and/or motor responses. It is more common in children than adults. Primary therapy includes reducing waking anxiety and increased sleep time. Night terrors are short periods of terror during N3 delta sleep. The person has no memory of the experience when waking. Night terrors are associated with extreme physiological arousal and are most common in children, particularly boys aged 4 to 12. Primary therapy includes reducing waking anxiety and increased sleep time. Nightmares occur during REM sleep, and the content of the dream can be recalled after waking. Physiological arousal is less than that experienced in night terrors. Nightmares are common in children aged 3 to 8. Sleep apnea can be one of two types: obstructive, where there is a physical obstruction to the airway, or central, which is associated with brainstem respiratory neurons. Sleep apnea is characterized by an interruption of breathing and an associated decline of oxygen content in blood during sleep. This is called nocturnal hypoxia. Sleep-related hyperventilation is associated with reduced ventilatory response to hypoxia. This results in persistently low oxygen content in blood during sleep in the absence of apneic events. Sustained blood oxygen desaturation during the day is key for the differential of sleep-related hyperventilation from sleep apnea. Restless leg syndrome is characterized by a creeping, crawling feeling in the legs that occurs primarily at rest. It is temporarily relieved by movement, it may delay the onset of sleep, and is worsened by fatigue. Treatment includes exercise and increased sleep time, or drug therapy with a dopamine agonist. Instant Neuro!